Hypoglycemia occurs when the blood glucose is below the normal range. It mostly occurs by the side effects of medication from diabetes. When we eat food, the food we take is broken down in our body and converted into glucose. Now, that glucose will move into the bloodstream with the help of insulin, and insulin is a hormone secreted by the organ called pancreas. Now, the insulin will help that glucose move into the cell where it produces the fuel the cell needs to boost energy. Excess glucose is stored in the liver and muscles in form of glycogen. Absence of food for long hours, the blood sugar level in the body will drop and the body will stop producing insulin. Another hormone from the pancreas called glucagon will signal the liver to release glycogen. Glycogen will breaking down to glucose and send into the bloodstream. This keeps the blood glucose or the blood sugar into a normal range until food is eaten again. A person with diabetes tends to take insulin, and the person could be either cannot make insulin, which is in the case of type 1 diabetes, or the body does not react to its insulin produced, which is in the case of type 2 diabetes. The person tends to take insulin medications because there will be a lot of buildups of glucose in the bloodstream. But intake of that too much insulin could lead or result to the blood glucose to be very low and it will drop drastically, which is a very dangerous level for the glucose to drop. So there's another possible cause even without diabetes, that even if the person is not diabetic, there is a possible cause of having hypoglycemia. We have causes like medications, we have excessive drinking of alcohol. Secondly, we have excessive intake of alcohol without eating can lead the liver to release more of glycogen stores it has, and which will automatically lead to hypoglycemia because the store form of glucose in your body, which is the glycogen, is being released because the person takes more alcohol and releasing glycogen so that there will be glucose in the bloodstream. So it wears out the stores it has, and that leads to hypoglycemia. Now, for medication, a person can mistakenly take in oral dosage of a diabetic patient drugs mistakenly, and this will lead to drastic fall of the glucose in the body, which is very, very dangerous. There is the saying that they said hypoglycemia tends to pose more danger than diabetes itself because it comes suddenly and the impact is severe. The cause of hypoglycemia is prolonged fasting or prolonged starvation. Yes, when a person did not eat for a very long period of time, the body now used up the stored form of glucose, which is glycogen. And when that stored is worn out, the body moves to another alternative source, which is the fat. Now, when the body uses up fat stores, which is we call them triglycerides, then the body is prone to have hypoglycemia because there's no way the body can um, source out this glucose from. It has used up the stores for glucose because when there's excess glucose, the body store it as glycogen. Now the body goes to the glycogen and take it and use it up. Now there is another store, we call them triglycerides or fat. The body use that up, then there is no way the body can source out glucose, then the blood glucose drops totally and leads to hypoglycemia. If you are just joining us and if you don't know me, my name is Farideshu Aibu and I am your wellness coach. I'm here to tell you everything and anything you need to know about your wellness. Do well to like, subscribe, follow me, and share this video to your loved ones, to your friends, to your enemies, anyone, for a better